treatment is basically tailored according to the clinical findings that I've determined, right? So like I mentioned, acute symptoms usually resolve within 7 days. Most likely it has resolved, or you might just be visiting the GP, get some antihistamines, get some douching, and then you're good to go. So when you see an ENT surgeon, of course, it's not settling. We would try the maximal medical therapy, meaning I would decongest your nose with a nasal decongestion, probably add in a steroid spray, and then douching to clear out all that secretion. However, this is a temporary measure. If this fails, then the opening of the sinus cavity is blocked. So then you would require surgery, which should be termed as functional endoscopic sinus surgery. Why functional? Meaning only the area that is inflamed, right? Those areas only are targeted, and to restore back the mucociliary clearance, the function of the sinus cavity, that's all. Surgery is basically done under general anesthesia. Of course, in this era, everything is done endoscopically. So there's no major invasive surgery as in cutting and flapping your nose. It's all done endoscopically. So some patients is done even as daycare procedure, meaning you do it today and you're good to go after 8 hours observation. Depending on how bad is your sinusitis, meaning is it affecting only your maxillary sinus or the sinus in your cheekbone? Or is it only affecting your sphenoid sinus, meaning the posterior group? So if it's affecting only these few groups, then you are entitled for balloon sinoplasty. You don't need all areas to be opened up. So balloon sinoplasty is non-invasive, whereby a balloon is introduced endoscopically into the ostium opening, the opening of the sinus cavity. And the balloon will dilate this opening, and all those entrailed mucopus can be suctioned out. And douching is done to restore back the function of that sinus cavity.